Understanding the chills? An introduction to cold-related illnesses. Cold-related diseases are health problems. They are caused or made worse by cold temperatures. Our bodies are designed to work hard. They try to keep us warm. But sometimes the cold weather is too strong. It can overwhelm our body's natural defenses. This can lead to serious health issues for anyone. It is very important to understand these risks. Knowing about them helps us prepare. Especially when the weather forecast predicts a drop in temperature, we must be vigilant. This knowledge is our first line of defense against the cold. Why is it important to discuss this topic, even on a day like May 21st, 2025? Well, cold weather can be unpredictable. Some regions might experience unexpected cold snaps late into spring. Also, many people travel to colder areas for holidays or work. So, understanding cold-related illnesses is a concern throughout the year. It is not just something to think about during the deepest part of winter. Being prepared means knowing the potential dangers well in advance. This knowledge empowers you to protect yourself effectively. It also helps you protect your family and friends. Our bodies have amazing built-in ways to stay warm. These systems try to keep our core temperature stable. For instance, when you shiver, your muscles are working to generate heat. Your blood vessels near the skin's surface constrict. This action helps to reduce heat loss from the body's core. However, when exposure to cold is too long or too severe, these defenses can be overcome. This is the point when cold-related diseases can begin to develop. Think of your body like a fortress with strong walls. A prolonged siege by intense cold can weaken those walls. This essay will serve as your guide through these cold weather challenges. We will explore some of the most common cold-related conditions. We will look closely at what causes them to occur. We will discuss how to recognize their specific symptoms early. And very importantly, we will talk about the available treatment options. We will also spend significant time covering how to prevent these illnesses in the first place. Think of this information as your personal health briefing. My primary goal today is to provide you with clear, simple information. This is information that you can use effectively to stay safe. Let's begin by discussing hypothermia. This is a very serious medical condition. It happens when your body loses heat much faster than it can produce it. As a result, your core body temperature drops to a dangerously low level. This drop in temperature significantly affects your brain. It can make it very hard to think clearly or move properly. Hypothermia also impacts your heart and other vital organs. It is considered a medical emergency. It requires immediate attention from healthcare professionals. Recognizing the signs early is truly crucial for survival. Next, we have frostbite. Frostbite is an injury to the body that is caused by freezing. The skin and the underlying tissues freeze. The most commonly affected body parts are the extremities. These include your fingers, your toes, your nose, and your ears. You can think of frostbite as being similar to a burn, but it is caused by extreme cold instead of heat. In milder cases known as frostnip, it causes numbness and redness of the skin. More severe frostbite can lead to blisters. In the worst-case scenarios, it can cause permanent damage and tissue death. Sometimes amputation of the affected part becomes necessary. We also need to talk about the common cold and influenza, often called the flu. These are both respiratory illnesses. They are caused by viruses, not directly by the cold temperature itself. However, cold weather often means people spend more time indoors. This leads to closer contact with other people. This increased proximity can significantly increase the spread of these viruses. Additionally, some scientific research suggests that breathing in cold air might slightly weaken our airway's natural defenses against infection. So, while cold temperatures do not directly cause these illnesses, they can certainly contribute to their spread within communities. Knowing the symptoms is key to identifying these conditions quickly. For hypothermia, look for persistent shivering. However, as it worsens, shivering may stop. Other signs include slurred speech, unusual drowsiness, and marked confusion. Clumsiness or a lack of coordination is also common. For frostbite, watch for skin that appears pale, grayish, or waxy. The affected area will feel cold and numb. The common cold usually brings a runny or stuffy nose, a sore throat, and a cough. The flu is often more severe. It typically includes a sudden fever, body aches, chills, and significant fatigue. Acting fast on these signs is important. Treating hypothermia requires urgent medical care. It is a life-threatening emergency. The very first step is to get the person out of the cold environment. Carefully remove any wet clothing they are wearing. Then, you need to warm the person, but do it gradually. Use blankets, dry clothing, or even body-to-body contact. If the person is conscious and able to swallow, you can offer warm, sweet, non-alcoholic drinks. Avoid using direct heat sources like hot water bottles or heating pads directly on the skin. This can cause skin damage or even trigger irregular heartbeats. Gentle, slow rewarming is always the safest approach while waiting for medical help. For frostbite, it is also important to seek medical attention, especially if it's more than a mild case. Move the person to a warm place as soon as possible. Gently remove any wet or tight clothing from the affected area to improve circulation. You can try to rewarm the frostbitten area using warm water. The water should be comfortably warm to the touch, not hot. Ideally around 100 to 105 degrees Fahrenheit. Soak the area for about 15 to 30 minutes. Do not rub the frozen skin or use direct dry heat like from a hairdryer, as this can cause more tissue damage. Pain during rewarming can be intense. Managing the common cold and the flu usually involves supportive care at home, especially for mild cases. Rest is extremely important. Your body needs energy to fight off the infection. Make sure to drink plenty of fluids. Water, clear broth, and diluted fruit juice are good choices to prevent dehydration. Over-the-counter medications can help relieve some symptoms. For example, decongestants can ease a stuffy nose, and pain relievers can reduce fever and aches. For influenza, a doctor might prescribe antiviral medications. These drugs work best if they are started very early in the illness, usually within the first 48 hours of symptoms appearing. Understanding the causes helps us prevent these issues. Hypothermia and frostbite are directly caused by prolonged exposure to cold temperatures. The main factors are low air temperature, the wind chill effect, dampness or wetness, and wearing inadequate clothing for the conditions. Certain individuals are at higher risk. This includes the very young, the elderly, those with chronic medical conditions, and people who consume alcohol in cold environments. The common cold and influenza, on the other hand, are caused by specific viruses. However, cold weather often facilitates their transmission by encouraging people to gather indoors in closer proximity. Prevention is always, without a doubt, better than cure. This statement is especially true when we talk about cold-related illnesses. Dressing in layers is a fundamental strategy for staying warm. Layers of clothing trap air between them. This trapped air acts as an excellent insulator against the cold. It is advisable to wear a hat. A significant amount of your body heat can be lost through your head if it is uncovered. You should also cover your mouth with a scarf or a mask. This helps to protect your lungs from breathing in very cold air directly. Mittens are generally better than gloves for keeping your fingers warm. It is critically important to stay dry. Wet clothing loses its insulating properties very quickly. This dramatically increases your body's heat loss. You should change out of any wet clothes as soon as you possibly can. This includes clothing that has become damp from sweat during physical activity. Always pay close attention to weather forecasts before going out. Be aware of the predicted temperature and, importantly, the wind chill factor. Wind can make the air feel much colder than the actual temperature. Limit your time outdoors during periods of extreme cold. If you must be outside for long stretches, take frequent breaks in warm shelters. For preventing viral infections like the common cold and the flu, good hygiene practices are crucial. Wash your hands often with soap and water. Scrub them for at least 20 seconds each time. If soap and water are not readily available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Try to avoid touching your face, especially your eyes, your nose, and your mouth. These are common entry points for viruses into your body. Cover your coughs and sneezes with a tissue, or use your elbow if you don't have a tissue. Stay home if you are sick to avoid spreading germs. In conclusion, cold-related diseases can range from being merely uncomfortable to becoming severely life-threatening. Understanding conditions like hypothermia, frostbite, the common cold, and the flu is very important for your health. Knowing their causes, being able to recognize their symptoms, and being aware of the appropriate treatment options empowers all of us. However, the very best approach is always proactive prevention. By dressing warmly in layers, staying dry, being mindful of the prevailing weather conditions, and practicing good personal hygiene, we can significantly reduce our risk. Stay informed, stay warm, and make your health a priority.